Welcome back to my YouTube channel, Health Matters with Dr. Shritama Banerjee. I am back again with a new video, this time about one of the most essential components of human life or any kind of life, water, H2O. So, you must be knowing, and it is very important to know, that water consists of around 60% of the body. Then, and what is the importance of water? Water is required for several works, for several functions of the body. For example, blood circulation, or for the matter, any circulation, blood, lymph, and other things. Water is important for easy digestion and easy evacuation of stool. Water is important for joint lubrication. You must be knowing that in the joint spaces there is a fluid which is known as synovial fluid, which provides the lubrication and the shock absorbing activity of the joints. Then water is present, a thin layer of water is present over the cornea, which provides easy lubrication in the eye and good vision. Water is important for keeping our teeth healthy, for keeping our skin healthy. Water is important because it decreases the chances of kidney stones and urinary tract infections. So, in other words, water is important for the proper functioning of all the organs of our body. So, now coming to how much water is required in a day. As per the Academy of Nutrition and Dietetics, males require 3.1 liter of water per day and females require 2.1 liter of water per day. However, this is not that simple. This was on an average, and the requirement of water will vary according to the physical activity that you do, the profession you are in, your location, your the season, your basal metabolic rate, and many other factors. So, if your basal metabolic rate is high, that is, you will realize that some people, even though they eat quite a lot, they do not gain weight easily. So, this means that their basal metabolic rate is higher. In that case, in these people, you will require more water. In case your basal metabolic rate is lower, you will require less water too. In case you live in a hill station or in cold climatic conditions, you will require less water because you sweat less and there is less water loss from the body. So you need to consume also lesser water than in summers or in hot climatic conditions. In case your profession demands that you spend a lot of time outside your house in the heat, in the sun, then you require more water. For example, if you're a salesperson, if you're a hawker, or if you're a sports person, if you require more physical exertion in your job, in your profession, then you sweat more and you need a lot of more water. Then there are two kinds of diseases in which you require less water. You should take less water. One of them is heart failure, and the second is chronic kidney disease. As you know, kidney is involved in excretion of water and also the waste materials in our body with in the urine. So, in case of chronic kidney disease, the kidney itself is damaged, and the nephrons, which are the excretory units of the kidney, is damaged, and therefore the function of the kidney, that is excretion of urine, is decreased, and therefore there is water accumulation in the body. And on top of that, if you drink more water, then it will put more effort on the kidney and will lead to further kidney damage. So you should drink less water in case of chronic kidney disease. And similarly, in case of heart failure, the heart muscle is damaged and It is the heart is requiring more effort to pump the blood to the body parts, and this leads to fluid accumulation in the heart and in the various parts of the body, not in the heart, in the various parts of the body, in the feet, which leads to pedal edema or the feet being swollen. And in such cases, if you drink more water, then this will lead to more pressure on the heart, more effort, more exertion on the heart, and this will aggravate the heart failure. So, in case of heart failure, also, you should drink less water. However, for kidney disease, chronic kidney disease, and heart failure, you should consult your physician before going into any um, changes regarding water consumption. And it is unwise to say advise more on this over a YouTube video. So we shall discuss about this face to face in case it is required. And also, on an average, we can say that senior doctors have also said that on an average, for a normal person, you require 35 milliliters of water per kg per day. So if you are a 60 kg weight person, then you require 35 into 60 milliliters of water per day. And if you're more into physical activity, if you're a sports person or you're into extensive gym workouts or extensive running or jogging or swimming, extensive physical exertion, then for half an hour physical activity, you require 300 milliliters more water. And for 1 hour physical activity, you require 300 to 350 milliliters more water for half an hour physical activity, and 600 to 700 milliliter more water for 1 hour of physical exertion. So, this was broadly about water consumption. And the next point is, how will you realize whether you have less water in your body? There are certain signs and symptoms which you will experience in case you have less water in your body. So, the first of all, you will have constipation or hard stools or trouble evacuating stools, which can also lead to quite unpleasant diseases like piles, fissure, if ultimately all is because of less water and trouble evacuating stools. You can also suffer from vertigo, dizziness. That is, you feel that everything is rotating or that you are rotating and the head is reeling. That's vertigo. That can also be due to less water in your body. It can lead to dry mouth. The you feel very dry skin, dry mouth, weakness, lethargy, muscle cramps also, and again, severe dehydration is recognized by three signs. One is confusion, that is, suddenly you feel like blank and you don't understand what is happening, and it's a neurological symptom which you feel confused and you feel you don't realize what is happening, and this can also be a symptom of dehydration, severe dehydration. You can have stomach ache. Just imagine, stomach ache can also be, although it's a very uncommon symptom of water deficiency. However, stomach ache can also be due to water deficiency. And there's another symptom, which is extreme lethargy, extreme weakness. You don't feel well enough to rise up from the bed and do your own household work. That's extreme lethargy. That's a sign of severe dehydration as well. So, and also water toxicity, that is having excess of water per day, that's also very harmful. One of the extreme harmful conditions that can arise is hyponatremia. That is, you take so much water. As you know, the important ions of our body are sodium, potassium, chloride, magnesium, calcium, and others. So, the most important extracellular ion in our body is sodium. And if you have too much water, then there will be more amount of water uh, and there will be less amount of sodium. Like the amount of sodium is constant, but the amount of water is so much that we call it dilutional hyponatremia. That is, the amount of sodium is being lost in the dilution that is being caused by the excess amount of water. That can also lead to confusion. So, confusion can be due to dilutional hyponatremia, due to excess of water intake, and also due to severe dehydration due to deficiency of water intake. So these are various symptoms. So this is the serious part of it. However, in simple terms, on an average, a normal person has to take around 35 milliliters of water per kg per day. So this brings me to the conclusion, to the end of my video, and we'll meet again on my next video. For the time being, bye bye and stay safe.